Kaleida Health is the largest healthcare system in Western New York and is also the largest employer. We have roughly $2 billion in gross revenue. We have everything from home care agencies to acute care hospitals, including a freestanding children's hospital, multiple outpatient clinic sites, as well as several emergency departments. We've been looking for telemedicine solutions for years. They've been technically difficult to implement. They've not been easy from a patient perspective or a provider perspective.
Initially, we had a need related to COVID, but that same need for COVID is something that we want to use in the future as well. The reality is that the times have changed, the markets have changed, demographics have changed, and consumerism around patient care is also changing. So we really needed technology that was simple to use for both the physicians, the clinicians, and also the patients. And using the Cisco Aspire product really met that expectation. As part of the implementation of this technology, we also wanted to make sure it had a brand as well. So we came up with the idea of KaleidaCares. So we have a KaleidaCares website. That's where this application is housed. It's fully integrated into our EMRs as well, securely, but really to be able to market it to our patients and our physicians.
The primary thing that it did for us, it allowed us as a healthcare system to preserve our personal protective equipment. It allowed us to not necessarily have every one of those patients come into our buildings, put on a mask, utilize gowns, take on and use very critically low personal protective equipment as we've seen across the entire country.
We essentially built the emergency medicine part of this process in about an 8-day period, which is incredible, the amount of dedication that everyone has to really do the right thing and come together and get something like this off the ground. Using the emergency telemedicine platform has been great. It allows us to see and evaluate patients while we're in the hospital, where we are anyway, and really kind of go into a patient's home and assess them there. So particularly patients with cough or mild shortness of breath that don't have severe symptoms but just aren't sure if they want to come into the ER or not, we can evaluate them, and then we're able to write prescriptions and send them to the pharmacy so patients can be seen by the doctor, get a prescription, and hopefully get better without ever having to leave their house.
I can tell you the story of an 89-year-old woman that initially, and it was my first telemedicine video visit, that initially she felt hesitant to do it, but we did it together, and when we connected through video, she was very pleased that she can talk to me over video and discuss all her medical problems and also her concerns about the current pandemic. I think it was, for her and for me, a life-changing experience.
Our Cisco KaleidaCares application has been fantastic in really bringing our care teams together across the continuum. It allows us to much easier bring our case managers, our physicians, and/or advanced care providers or nurses together to manage a patient as a team.
The one thing that really shocked me is, because again, I've been in this business a long time, and especially in healthcare, things take a long time. Aspire and Cisco got involved. They brought in the right resources. We worked collaboratively with them, and we brought up this entire environment probably in 10 business days. Now, was it perfect from day one? No. But within the next, I'd say 5 business days, it was in a score of 1 to 5 for maturity. It was probably around a 4, which is unheard of in healthcare. So they were able to bring the resources together, integrate with us, and work well with us, with the expectation that we need to get this up very quickly, and they did.